Mandatory early screening for autism spectrum disorder. Help parents help their children. This presentation is by myself, Kelsey Whitelaw, along with Cheyenne Cody de Rosa, Noelle Franks, Cody Hopper, and Mi Nguyen at Arizona State University. Imagine you are at a playdate with your 18-month-old and your friend who is a child the same age. You notice that the other child is playing alongside the other children at the playground, but your little boy is standing off to the side. Later, your friend's little boy comes up to her and asked her for a Wawa, and he was given water. Your little boy has never asked you for a drink of water, and now that you think of it, he never really asks for anything. You have been picking up on these small signs the last 2 months as you have been meeting your friend for playdates. Your friend's little boy is constantly babbling and using words to get his needs met, while your little boy is content to play quietly on his own. When you try to get your little boy to engage with you, he usually does and will let you play with him. His favorite activity is to line up all of his cars and flip them over to spin the wheel, which he tends to do repetitively. When your friend's little boy comes over to move the cars along the track, your little boy becomes very upset. You come over and model to your boy how to tell the other boy to stop, but he's too upset to listen. These playdates have been occurring on a weekly basis, and although your little boy will play alongside the other child, he doesn't seem to notice the other child at all. You wonder, is this normal? You're concerned, but he has stayed home with you all his life, and this is his first friend. So you brush it off as being an only child with little opportunities for socialization. At your child's 18-month well check, everything is going well, but you keep thinking about those playdates. You decide to bring it up to your pediatrician to see what she says. You bring up your concerns with his socialization and speech, you describe what's going on at playdates, and talk about how your child is not imitating you and is pretty quiet. The pediatrician politely listens, but reports that he's still young and you should give him some more time to develop his speech. He is only 18 months after all. The pediatrician suggested that you put him in daycare to help with the socialization and communication skills. He seems to be a little shy boy. Your pediatrician ends the appointment by saying, "Let's wait and see." This is a common response from pediatricians. In fact, a 2016 study by Adelman and Kubison found that 50% of pediatricians took a wait-and-see response to developmental concerns. Meanwhile, your child's behavior worsens and is causing you stress. A 2003 study by Baker and colleagues found that parents with children with developmental delays are more likely to suffer from parental stress. You know that your child is different from other children his age, but if your pediatrician is not concerned, then maybe you should wait and see. Your pediatrician knows best, right? Let's fast forward to age 4. You have waited and now you see. Your child is now diagnosed with autism, and the concerns you brought up starting at his 18-month well check were indicators that could have been caught on the autism screening tool that could lead to your child's diagnosis. Let's review some of those indicators from our scenario. Repetitive behaviors, such as playing with the cars over and over in the same way. Language delays, not using Wawa for water or using vocalizations to ask for needs to be met. Difficulties with social interaction, just as in the playdates, having a hard time playing with children and only playing alongside. And often, trouble with nonverbal communication is also a problem. such as eye contact. The MCHAT is a screening tool designed as a checklist to screen for autism in toddlers at ages 18 months and again at 24 months. The concerns you had would have elicited at least an at-risk diagnosis from a developmental pediatrician or psychologist. Your child could have been receiving early intervention services up until age 3, but now you've missed the cutoff. You also missed out on support to get services now after age 3. Now you're alone navigating the state systems to begin receiving services for your child. Now that those 2 years have gone by, how do you feel looking back? Angry? Frustrated? Ignored? Defeated? Helpless? Dumb? In Arizona, 1 in 64 children is diagnosed with autism spectrum disorder, as per the 2010 CDC survey. Parenting can be stressful to anyone. However, parents of children with developmental disorders like autism are more likely to suffer from parental stress and mental health problems, according to studies by Baker and colleagues in 2003 and Emerson in 2003. Arizona Early Intervention Program, the AZEIP, provides a team of speech therapists, occupational therapists, physical therapists, developmental specialists, psychologists, social workers, all to children that qualify for the program. These services are provided through a team-based model. Their families' priorities are addressed, and a lead therapist provides support and gives strategies for parents and caregivers to implement throughout their daily routines. For children with an at-risk or diagnosis of autism, Applied Behavioral Analysis, ABA, is a service that can benefit them. ABA services cannot be provided through the Arizona Department of Developmental Disabilities until an actual diagnosis or at-risk autism has been given to a child. An official diagnosis is required for insurance to cover the costs of treatment of autism, such as ABA therapy. Parents just need to get their child the diagnosis, and then they can access the services. Fortunately, wait lists are long in Arizona, and so the need for early screening of autism is even more important, as it can get the child on the wait list earlier. Significant levels of parental stress are linked to lower levels of parenting competence and confidence, according to a study by Keene, Cousins, Musprat, and Roger in 2010. And the inability to connect with necessary services and supports was identified as one of the primary factors that cause this parental stress. Keene and colleagues found in 2010 that providing parent-focused interventions by providing professional support and guidance immediately following a diagnosis of autism can lead to reduced levels of parental stress. The study found parents will be more efficient and equipped to handle their children's challenging behaviors, and they will learn how to seek out necessary treatment for their child. With support, parental stress decreases and parents feel more competent. However, parents are left helpless due to insurance requirements until a diagnosis has been provided to their child. Arizona's children deserve access to all resources available to them. Mandatory autism screenings can get Arizona's children diagnosed at an earlier age. According to the CDC's 2010 survey, children in Arizona are being diagnosed on average at the age of 4 years and 11 months, years after the AAP recommended toddler screening ages of 18 and 24 months. A study by Barton, Dumont, Matthew, and Thien in 2012 identified a need to screen at least twice and that is to catch children who regress after the initial screening. According to data from Bayo and colleagues in 2014, the median age for diagnosis was 4 years and 3 months, so the Arizona average is behind the national average. If screenings are available at 18 months and 24 months, why are children not being diagnosed until they are almost 5 years old in Arizona? The simple answer is the screening tool available to pick up on developmental delays related to autism are not being used by pediatricians in Arizona. If the tool was being used at the appropriate time, children could be referred to other physicians, providers, and programs to get further testings and evaluations completed. Then, once diagnosed, they can start early intervention. A study by Suma, Adamson, Bakerman, Robbins, and Abrams in 2016 found huge benefits of starting early intervention, including improving the child's IQ, behavior, autism diagnosis, and improved parent-child engagement. This means the entire outlook for autism changes for the child. Kogel, Ashbaugh, and Bradshaw found in 2013 that the earlier a child receives interventions after diagnosis, the more likely they are to show the greatest developmental strides. Turn 3, Sorry Charlie. In 2016, there were 16,155 children referred to Arizona's early intervention program. 33% of those children became eligible, meaning they had at least 50% delay in one area of development, so they went on to receive early intervention. 26% of the children did not qualify, and almost 41% of the children who were referred had their case closed before eligibility could be determined, meaning they were over the age of 3 and missed the cutoff. Data from 2017 showed that 41.4%, so even more children referred, had their cases closed before eligibility was determined. So 6,524 children never even had the chance to qualify for early intervention. It is so important that Arizona's pediatricians evaluate using early detection tools to avoid having these 6,000 plus children not receive evaluations that could help them and their families receive further support. The CDC identified that 90% of children diagnosed with autism had parents with concerns by the age of 3, just like that imaginary scenario at the beginning. Yet, only 34% of them received an evaluation by age 3. Again, just like that imaginary parent scenario, all left to feel angry, helpless, and ignored. There are many programs out there to support children with developmental delays, including Arizona Early Intervention Program. Programs like AZEIP can help parents navigate the state systems and provide parents with information on child development and any resources available. It is unfair to the children of Arizona to not receive something as simple as an evaluation. This is something that can be covered by the state and is free of cost to the families. Every child deserves the opportunity to live their fullest potential. So, is this situation hopeless? No. The answer is in the MChat. To address the need for pediatrician screening of toddlers, we recommend the Health and Human Services Committee establish a best practice protocol for early autism screening by pediatricians. This would require that all pediatricians in Arizona employ the Modified Checklist for Autism in Toddlers, the MChat, to screen toddlers at 18 and 24 months. This was shown to be an effective way to diagnose autism early by a study in 2013 by Chablowski, Robbins, Barton, and Feen. Requiring the MChat as part of an autism screening best practice protocol would help parents receive the support they need sooner. Having all pediatricians trained in employing this evaluation sounds expensive. Well, there are also cost-saving benefits to early diagnosis. When left untreated, a study by Kogel, Ashbaugh, Bradshaw in 2014 found symptoms of ASD can become more severe and require more expensive intervention if not treated early. Early diagnosis leading to early intervention could potentially prevent these costly interventions later in life, as well as saving from 18 years of special education. A study by Jacobson, Mulick, and Green in 1998 estimated that a state could save over $1 million per child over their lifespan when employing early interventions. And Chassen, Harris, and Neely in 2007 estimated that state savings for Texas to be over $2 billion total. Although pediatricians are not to take all the blame for this, they are the ones most often trusted by parents as a professional in the field of child development and someone the parents see most often. A 2010 study by Fountain, King, and Behrman found that factors such as parents' socioeconomic status, race, and birth order can all have an impact on age of diagnosis. A survey conducted by the AAP in 2009 revealed that only 47.7% of primary pediatricians were effectively utilizing standardized screening methods. In 2011, Radecki and colleagues found that 14% of children have a developmental delay by age 2. But only 10% of those identified are receiving services to meet their developmental needs. There are many different factors that could affect the lack of service, including parents' unwillingness to participate. It is important that parents understand the implications and the ramifications that could occur when children are not receiving appropriate services. Temple Grandin says, autism is a neurological disorder. It's not caused by bad parenting. It's caused by, abnormal development in the brain. The emotional circuits in the brain are abnormal, and there are also differences in the white matter, which is the brain's computer cables that hook up the different brain departments. I love this quote as a way to picture autism and the way that it works in a child's brain. Temple Grandin, who is autistic herself, is a pioneer in the autism community, and this quote perfectly resonates the education she's been trying to provide to others. It is important that we all remember that although autism is not caused by bad parenting, it can be challenging to parent a child with autism when parents do not have access to appropriate resources. Most people can agree that parenting is not easy. It is a challenge that many people take on each day, and it is one that never ends. Early detection of autism helps relieve parental stress, as it gives parents an answer to their questions. The resources available for children with autism and their families is abundant, but the ability to access it without a diagnosis is limited. MCHAT is an important tool that all Arizona physicians working with children should be employing and utilizing within their practice. In order for parents to receive support, and it provides early enough detection to get the child referred to the appropriate programs. A simple at-risk diagnosis of autism in Arizona could provide these young children with early intervention services, ABA therapy. Let's decrease the stress a bit by helping Arizona's children with autism access the resources available. Let's catch these diagnoses early so that by the time Arizona's children with a diagnosis of autism is 4 years old, their parents are more confident in their skills and feel equipped to handle whatever life with a child with autism brings.